With her head in her hands, Briana Boston learned she would be held in jail on $100,000 bond.
Well, this story is absolutely insane. A 42-year-old mother of three is behind bars on $100,000 bail and facing up to 15 years in prison over an empty threat made to a health insurance company at the end of a call. So I'm going to get to the details of the story, including a clip from a local news report. I'm also going to get to what the New York Times is doing right now, which is amazing, as well as a clip from the UnitedHealth CEO, a recently leaked clip, and MSNBC's coverage of that, which I found encouraging, at least the coverage of it. But first, here is this story. This is out of Florida, in Lakeland. Lakeland woman threatens insurance company, says delay, deny, depose. So she ended a call to an insurance company with the words delay, deny, depose. And then they arrested her on $100,000 bail, throwing up to 15 years in prison at her. Before I get to more details, I saw this online. There's a lot of reactions online, and people are obviously outraged over how insane this is. But Spuddy here, I think this makes an accurate point, since I experienced worse as well. Says, I get harsher death threats than that playing video games. It's true. I get worse in YouTube comments. How can anybody possibly think what she's facing makes sense in any way at all? Especially considering that private health insurance directly leads to people dying when they're denied health care. But that's perfectly legal. Being angry about it is not. So, Briana Boston, 42, had reportedly placed a call to Blue Cross Blue Shield regarding recent medical insurance claims that she was denied. The entire phone call was recorded, according to the affidavit. This is from her lawyer, saying, quote, my client is 42, married mother of three, never had any criminal charges or convictions. May you release her on her own recognizance, her attorney Jim Headley said to a judge during her first appearance in court. However, the judge set her bond at $100,000, stating, quote, I do find that the bond of $100,000 is appropriate considering the status of our country at this point. So let me get this straight. The judge thinks that a $100,000 bond makes total sense because of the status of the country. Not because this woman's a threat, she clearly isn't, but the status of the country, people being angry about health insurance, legitimately angry about it. Because of that, this makes sense to the judge. It's hard to it's hard to absorb any of this because of how insane this clearly is on its face. I don't need to explain how insane this is. This was an empty threat. Now, you may want to argue, well, you can't be uttering threats. Okay, fine. A warning, maybe. But 15 years in prison? $100,000? So let me play for you this clip from a local news report.
The nature of the threats, we would also be asking for GPS with house arrest conditions to protect the community.
With her head in her hands, Briana Boston learned she would be held in jail on $100,000 bond. The Polk County judge adding the bond was appropriate given the, quote, status of our country.
It's not like she's a child. She's 42 years old, so we're not dealing with a child here. She should certainly know better.
Lakeland Police Chief Sam Taylor says his department was contacted by the FBI Tuesday. Authorities say in a recorded phone call about a denied insurance claim, Boston told a Blue Cross Blue Shield employee, quote, delay, deny, depose. You people are next, end quote. The language matches the words police say were written on the shell casings found at the UnitedHealth CEO's murder scene in New York City.
We will take this very seriously, and we will put you in jail if you do something like this. It is not a joke.
According to Boston's affidavit, the mother of three told police she did not own firearms and was not a danger to anyone. But she added, healthcare companies played games and deserved karma because they are evil.
Absolutely insane. In a weird way, I think this is actually going to get people even angrier. Seeing how the state is responding to the righteous anger that people have at private for-profit healthcare. Now, there's already a lot. I mean, here's another example of people's anger. Altoona police say they're being threatened after arresting Luigi Mangione. So they, right here, their quote: "This is clearly a very polarized case. We have received some threats against our officers in building here. We've started investigating some threats here against some citizens in our community. We're taking all those threats seriously and doing all the follow-up we can with those." So this this whole event has clearly sparked this overwhelming outrage at the healthcare industry. It's it it's wild that, there have been ongoing discussions, at least at times, about how insane for-profit healthcare is during the Bernie Sanders run for president in 2016 and 2020 during those primaries. It was, at least in political media and people following it, a lot of discussion around how insane for-profit healthcare is. But it hasn't seemed to really ignite people, or at least ignite the sort of political or politics free discussion around healthcare that this has. And I think it's because this is really a politics free discussion. We aren't talking about, healthcare in the context of a Democratic primary. We are talking about it in the context of the act of one civilian, one individual. And that is what has led to, whether you're, conservative, whether you find yourself left, right, Democrat, Republican, whatever, people are all seem to be aligned on how insane for-profit healthcare is. It's just a matter of also understanding the immense power that for-profit healthcare has on politics, the amount of money they pour into both parties, which is why you only have a handful of people like a Bernie Sanders, like Alexandria Ocasio-Cortez, Rashida Tlaib, Ilhan Omar, a handful of people that all are siding with Democrats, or all are Democrats, minus Bernie, who's independent, that are arguing for, a single payer system and have been discussing this issue well before this event came up. But this will hopefully continue. This kind of discussion needs to continue in order for politicians to actually feel any kind of pressure to do anything. Now, Ken Klippenstein shared this. So I actually got a couple things on the New York Times, because it is just wild what they're doing over there. But New York Times doesn't want you to see shooter's face. So an internal New York Times messages about its coverage of alleged gunman Luigi Mangione has been leaked to me, and the contents are revealing. On Tuesday, management said, quote, "The news value and public service of showing his face is diminishing, instructing staff to dial back its use of such photos." It also directed Luigi's manifesto not be published in the paper. So actively trying to, the whole reason they're doing this is to try and avoid, I guess, the impact that this event has had on people and their anger at the industry. And Ken Klippenstein links to a couple examples here. So this is one example where they don't show his face, they just show his back. Another story on it where they just show a building. So they're actively trying to avoid showing his face. Now, this gets to this insane story. They won't show the guy's face, but they will show an op-ed from UnitedHealth Group CEO where he says the healthcare system is flawed, let's fix it. Yet if you go on to read the piece, it's all it is a defense of UnitedHealth and private healthcare. There is no deep discussion here about how insane it is. Of course, to be clear, of course there isn't this discussion, because it is from a CEO, but no discussion about how insane it is to have a profit motive at the heart of a healthcare system. No, it's all about, let's work together to be at most, he goes on to say, we should be more clear about why we don't cover certain things. Well, here's the thing with that. So actually, he goes on to write, behind each decision lies a comprehensive and continually updated body of clinical evidence focused on achieving the best health outcomes and ensuring patient safety. Which that is not what their responsibility is. Their responsibility is to shareholders as a private corporation. And we know that as a fact because of this story that came out a year ago. This is from ProPublica. UnitedHealthcare tried to deny coverage to a chronically ill patient. And the patient sued them and was able to find internal evidence showcasing that they were hiding the help that this man needed because it was not beneficial to their profit or to their profit motive. So they go on to write here, at one point, court records show United inaccurately reported to Penn State and the family that McNaughton's doctor had agreed to lower the doses of his medication. So they lied as a way to lower the doses of his medication to save them a few bucks. Another time, a doctor paid by United concluded that denying payments for McNaughton's treatment could put his health at risk, but the company buried his report and did not consider its findings. So their own doctor was like, what are you doing here? This guy needs the help. But they buried his report because, again, it did not benefit their bottom line. They did, however, consider a report submitted by a company doctor who rubber-stamped the recommendation of United Nurse to reject paying for the treatment. So they found who they could to approve what they wanted to actually do, which was reject this man's health care. And that is the recommendation that they approved, while disregarding other doctors' findings. And not to mention, lying about how much he should be taking for his medication. So this idea that this company to be clear, not just UnitedHealth, that any private insurer cares about people or that they put people first is, of course, wrong. That isn't how for-profit companies operate. They have a fiduciary responsibility to their shareholders. And in fact, on that point, MSNBC discusses the leaked clip from UnitedHealthcare, and watch their discussion on it as well. I'm encouraged by seeing reports like this from places like MSNBC because you don't normally see this kind of coverage, at least this kind of consistent coverage on healthcare or criticism of healthcare. But here it is.
As you mentioned, UnitedHealth Group. This is their CEO, Andrew Whitty. This is an internal video that was leaked to journalist Ken Clipperstein. Take a listen.
Are going to make sure that we not only acknowledge and honor that legacy of Brian, but we'll continue it. Our role is a critical role, and we make sure that care is safe, appropriate, and is delivered when people need it. And we guard against the pressures that exist for unsafe care or for unnecessary care to be delivered in a way which makes the whole system too complex and ultimately unsustainable.
The idea of unnecessary care. If you need anti-nausea medication because you can't keep food down, that seems to me to be necessary care, but they're still saying no in cases like that.
These gentlemen have something called fiduciary responsibility. That means they have to, of course, return as much money to their shareholders as possible. That's their legal responsibility, just like as journalists, your responsibility or my responsibility is to tell the truth and inform people. So if people are paying them a premium to pay for their insurance, and in exchange for that premium they're getting care, the company is going to make the most money for shareholders by providing the least care. So to them, it makes a lot of sense to determine things that are unnecessary.
This is why the debate over healthcare is over. There is no debate. If you get into any discussion where someone's like, oh, sure, it sucks here, and for-profit healthcare sucks, but would you want to wait in long lines in Canada or the UK or whatever? First of all, you have lines too. I don't know why Americans, at least some Americans, conservatives, Ben Shapiro, pretend that healthcare is great. Healthcare actually is great in the US if you are wealthy. Of course it is. Because it's a for-profit system. It's a system that is designed to benefit the wealthy. But if you're, the average person, it's not. Because again, we are talking about a system where wealth is prioritized. People argue, oh, but there's rationing in universal, single-payer systems or, the UK system, a proper public health insurance system. There's rationing. Yeah, rationing based on need. In the US, you have rationing based on wealth. I guess it's up to you what you prefer. Would you rather a system where the wealthy get great health care and everyone else is a crapshoot? Or would you rather a system where need is prioritized? Now, again, I've discussed before, there is no perfect healthcare system. We all got our, gaps, issues. But if you were to ask me, do you want the for-profit American healthcare system, or do you want Canadian healthcare? I'm going to stick with Canadian healthcare because even though I've had my issues with Canadian healthcare, they are nowhere near the issues that I would have under an American system. And I know that based on the reactions alone. Even I've been, I'm someone who I've discussed healthcare and American politics for 10 years. Even I was surprised by the overwhelming reaction to uh, the events regarding, Brian Thompson. Because even though I was well aware people are angry about the healthcare system, it's been amazing to see just the unanimous anger. Part of I think the surprise for me was just that the anger didn't seem like it was there as much during the Democratic primary in 2016 or 2020 when Bernie was talking about Medicare for all. And while he was growing in support, the votes were not there to win those primaries. So that kind of caught me off guard when we get to this story and it's just like, oh, everyone hates this? Well, where were you before? When you potentially could have had a better system. But, that gets to another issue. A lot of people have busy lives. They don't follow politics closely. They're not voting in a primary. So that's a whole different conversation. But hopefully this has sparked something different where this kind of righteous anger, this discussion is going to continue and hopefully lead to some mounting pressure on future elections, on politicians to start cutting off private healthcare money and begin really focusing on what people need.